Welcome back to movementprofessional.com. So today we're going to do the next installment in the series It Hurts When I Do This. Today we're going to talk about upper to mid back pain when you're at rest. So this is something I've been seeing in the clinic more frequently. I've experienced a little bit myself. We're going to break this down into 3 discussion points. The first is the more mechanical discussion point of what area do we have to get moving better, or what do we have to assess for a lack of movement. And I would say that in the thoracic spine, we want to see how well you can rotate. And then just generally, how well do you rotate throughout the body? So a lot of times if you'll see somebody who is a little bit wider, might be quite strong, but is even doing a lot of exercises that are bilateral, the body loses its ability to rotate, especially in the thoracic spine, but throughout. So we want to have some exercises that can help promote rotation throughout the body, hips, shoulders, and thoracic spine especially. So that's concept number 1. Concept number 2 would be, how do we talk about postural variation? So we can think about what an ideal posture is, but in many cases, ideal posture isn't going to help this area, but more we need to have some type of plan for varying our posture more frequently. All right, so that's going to be something that we'll discuss and give a couple options for, especially if you have a job where you're at the computer a lot, or you have to be static frequently throughout the course of the day. And the last piece, which ties into the postural variation, is stress reduction. So this middle back area is basically the house of the autonomic nervous system, especially the sympathetic nervous system. So you can think on the front side of the thoracic spine here, you're going to have the ganglion of the sympathetic nervous system, which is basically your fight or flight response. So when I feel in myself and when I get the symptoms of mid-back pain at rest that tend to worsen with rest, or get worse or get exacerbated with rest, I think right away that we have to do something to calm down that sympathetic nervous system. So that's going to be something that it might be a little bit trickier to have an objective way of looking at, but the first thing we want to be able to do is assess your sleep. So if you aren't tracking sleep, get some type of metric for tracking sleep, because that's going to be a big one right there. And it's often underestimated by most people, because if something hurts, we got to think about, all right, what's broken inside the body, what joint is going to be able to be diagnosed, or what movement can we enhance to try to improve that. And movement will usually be useful, but a lot of times we have to keep any movement that we do in the context of, is it going to be something that's increasing our stress response, or is it going to be calming it down? So in this case, that has to be kept at the top of the priority list. All right, so sleep would be one. Being able to monitor your heart rate variability, and I'll link in the episode notes some references for that, or things that I use. I use Elite HRV using a chest strap heart monitor that I'm actually able to take a morning reading and see what my stress levels are pretty much. And I think the HRV, or heart rate variability, is a nice conduit to other things like what's your cortisol level and things like that. So that's going to be a harder thing to measure, but your HRV every day can give you a sense of what the status of your autonomic nervous system is. And that's going to be a big deal. So if you're having higher levels of mid-back pain, oftentimes you'll see that HRV is going to be a little bit lower than it normally would. So if you're not tracking that, that's going to be a big thing to just get in the habit of start tracking. It's not really that expensive nowadays to be able to do that, and it's getting more and more accurate. So that's going to be an important thing. So track your sleep, track your HRV. Those 2 readings right there, you're going to get some objective data on your stress response, and then you can use those data to do some interventions to see how it changes. So as far as an intervention then to bring the stress response down, we can think about breath work, right? So one of the things that we want to look at with breath work is how do we bring the respiratory rate down compared to what the baseline is. So most of the time when we're in a state of increased stress, we're going to get closer to hyperventilation. So first thing we want to think about is, can we bring the amount of breaths that we take per minute down? And then the best way to do this at first is to think about taking longer exhales as opposed to taking longer inhales. But eventually both can be involved in that. So I like to tell people initially to start with somewhere with a 3-second inhale, 6-second exhale, and then maybe bring that to a 5-second inhale, 10-second exhale. Once that can be mastered, then we can look at some other options. There's a 4-7-8 breath, but anything that extends out the breathing longer, and to have that be done for several minutes, right? So it might take a few minutes for that type of breathing to actually take effect and give you any type of benefit. But it usually will be pretty beneficial within 2 minutes. So don't just take 1 or 2 breaths like that, but give yourself a timer for 2 to 5 minutes and see if that can bring the stress response down. And then take note to how that affects your pain, because we're talking about pain mostly at rest here. It's not a specific movement creates this pain. It's just pain when you're sitting, you're standing, even you're lying down. So if you're noticing that, you actually have to do something to allow your body to rest better. And that's where we got to think about that stress response. And then we got to have, breathing would be the first way to bring the nervous system down into a more parasympathetic state. The other thing we can do to bring stress down, which falls in line with the breathing pattern, is we can do a little bit of pressure work. So we can think of it as foam rolling. We can think of just lying on different massage balls. But when we do that, we have to have in mind that we are really trying to bring the stress response down. We're not trying to beat up the area that is sensitive. The area is already sensitive. So if we create pain to the area, it may make it feel better temporarily, but we're just as likely to irritate the area. So the whole goal of bringing pressure to the area should be that our body melts or relaxes into that pressure. The pressure deepens into our anatomy. So we are working theoretically on tissue mobility, but we're also demonstrating to our body that we can melt into pressure, that we can tolerate pressure better. So we can think about any of that work. I'll demonstrate a couple examples just so you get a sense of what I'm talking about there. But the intention of any type of pressure therapy work should be to relax deeper into that pressure, make that pressure less of a threat to the body. So that's another way we can think about that stress response. And then talking about postural variation, that's where the two sort of blend together. So getting on a foam roller, getting on the ground and putting a ball in different parts of the body, we can think of it as a myofascial release, that there's specific tissues that are being released. Or I like to just think like the broadest category of benefit that you're getting from that is that you're changing your position frequently and you're doing it in some type of systematic way. So if you have a 20-minute program where you put a massage ball on your upper back where it's painful, but then you also look at the back of your shoulder, or you might put a ball on the chest, and then you might even work down on your thighs, even if it doesn't hurt there. You're just moving pressure around your body. Well, you're also moving your body around that pressure. So you now are varying your position, you're creating postural variations, and that's going to be more rest for your body than you can do by being stationary. So when we're talking about this pain here at rest, it's almost a misnomer to say at rest, because the postural muscles are always holding your head up, right? And if you're in a state of stress, well, now the tension in the postural muscles tends to be greater. So you have to do something different to actually create rest. So movement and variation of posture becomes rest as opposed to static positioning. And that's really important to understand. So the rest and postural variation go hand in hand, but we just have to make sure that you're not just moving for the sake of moving, you're moving for the sake of actually calming down the stress response somewhat. And then again, going back to thoracic rotation, and that the first concept we're talking about, getting actual movement to this area, that's going to be important, but we have to do that with the mindset of we're actually trying to rest the body. So let's go over a couple things of what I talked about there, just that can be used, but they have to be used in this way that we're always keeping these three things in mind, and that we're doing it really keeping that idea of reducing the stress response as our top priority. So getting on the ground here, we'll talk about different things we can do to vary our posture, and we're going to say our posture compared to a sitting posture or a standing posture where we're more upright in relation to gravity. So I have 3 different balls, so I'll show 3 different exercises that work generally around the rib cage, thoracic area, that should get our body in 3 different positions, but at the same time put direct mechanical pressure to near the area that is painful. All right, so the first ball we're going to use is this purple Coregeous ball. It's a deflated ball that's very broad. I'm going to put it on my abdomen, but right below my rib cage. So the idea is that I'm getting under the rib cage as much as I can towards the diaphragm. But if we think about that area wrapped right around is going to be the thoracic spine. So if we bring in the skeleton here, you can see like right under the rib cage. On the other side of that is the lower part of the rib cage and also the lower thoracic spine. So that's where we're going to be working on there. All right, so we'll take the ball, I'm going to put it right under the rib cage there. I'll start propped up, and then I just want to melt over this position. All right, so putting a ball in your abdomen can be threatening, but if we allow ourselves to spend some time here and do some breath work on it, and we allow the ball in, it's also a very direct assessment of how much our sympathetic nervous system is active and how much our parasympathetic nervous system might be active. So the more active our sympathetic nervous system is, the less likely we're going to allow that ball in. If the ball gets deeper into us and we become more okay with that, it's an indication that our bodies are getting farther away from fight or flight. They're not threatened by the pressure of the ball. So this is something that we might have to spend some time doing. Up here tends to be less threatening because there's less pressure. Down here becomes a little bit more threatening. Having less pressure in the ball or less air in the ball is also a little bit less threatening. So we can progress this gradually. So once we get here, I want to breathe in. As I inhale, I'm actually creating direct motion to the mid-back. So if I feel some pressure going forward into the ball, I also am going to imagine that the opposite side of me is going up towards the ceiling. So I'm going to create this sort of cylindrical pressure forward, and then also my upper back moves towards the ceiling. So that's creating some expansion in that area, which is a way to think about I'm creating decompression also of that area and some motion to the tissues there. As I exhale, I'm just going to melt, and I just want the ball to sink in as deep as possible. And I want to feel that this is comfortable, almost like I'm falling asleep on it, right? So it's not going to be perfectly comfortable, and I appreciate that, but I want my body to feel as loose and relaxed and heavy as possible. So say at least 2 minutes there, and just see what that feels like, see what it does to the upper back symptoms that you may have. So that would be one option. Another option would be taking this orange ball, it's a trigger point ball, and putting it right on the chest. So you can think of the pec area is also the front of the rib cage, and the lung is right underneath there. So it gets us into a slightly different position. So we're still in a prone position, but now I'm going to put the opposite leg on which the ball's at up into this flex position, and I'm going to put one arm overhead or even out to the side, wherever it feels best and creates the most pressure. But it's just varying my position a little bit. I'm also going to turn my head away from the ball so it creates a different rotation in the neck. And now my goal here is again to get heavy into the pressure. So I'm breathing into the ball, trying to feel the left lung in this case inflate into the ball, and then exhale. Think about the lung deflating and me getting heavier into the ball. All right, and then I can move the arm into different positions. You can also just hold that pressure and move the arm around it, which can be useful. Gets a little bit of shoulder mobility around this fixed pressure. All right, so I can do that on both sides. So that gives me more of a one side at a time type of pressure. And I get to vary my position a little bit more. And then the pinky ball here, I can go between the shoulder blade and the spine. And I'm in a more supine or hook lying position here. The arms can be in a couple different positions. I like to just put them out to the side as long as I can get the back of my head touching the ground here. I'm going to reach my arms away from each other, so I'm imagining the space between the shoulder blade and spine opening, and that allows the ball to fit in that alleyway a little bit better. And then I can do a mild little bridge into the pressure, come down. It depends on how sensitive this area is right now. So if it's very sensitive, I may just be hanging out here, and I might not go on the most sensitive spot. I might go a little bit above, a little bit below. All right, so the first thing I gotta be able to do is just desensitize into the pressure. So I'm gonna inhale, think about the back of my lung inflating into the ball now. And then exhale, as I deflate, I get heavy into the pressure. Okay, and then if that feels okay, I can move my arms around that. I can start moving my arms overhead. I could explore the pressure with arm motions or with some spinal motions where I bridge and roll around that pressure. All right, but either way, I'm in three different positions there. So I'm in 2 different variations of prone, and then I'm in a supine variation there with pressure moving around the body. So as I move pressure around the body and my intention is to relax, I'm going to hopefully bring down my stress response, increase the parasympathetic activity in the body, which will tone down the high level of sensitivity that I have in that mid-back. All right, and then to look at enhancing a little bit of rotation there. So doing anything on one side at a time is also going to start to subtly enhance rotation. So if I put the ball on my right pec versus my left, I'm starting to actually create a little bit of a rotational movement. But to get a little bit more aggressive with that, aggressive in a way that we're still able to relax into it, we can do some things on the side here. So a progression that's nice to work with is just starting with the knees stacked here and then just grabbing the rib and moving through here. The key is that the head has to be able to relax onto something. So I don't want my head reaching for the ground, so if I need to put a pillow there, I will. But with rotation, I want to just make sure that one area, so I'm going to say my lower body is fixed in place, and then I'm moving the upper area at the rib cage away from that, right? So I'm trying to not think about the back of my left shoulder getting to the ground, but more of the left side of my spine or left side of my rib cage getting to the ground. All right, so I'm going to take a breath in and then exhale, and I want to use the breathing to get me to move. So if I use the breathing to get me to move, my breaths are going to tend to be longer. So I'm going to be taking less breaths per minute. That's going to calm down my stress response. So rotation can be very relaxing if we do it well. We don't try to force it. All right, so that would be the easiest one. We do a rib grab. I can take the arm and reach it here, but it's unnecessary because you want it to be thinking of it coming from the rib cage more than from the shoulder. And the goal isn't to touch this hand to the ground. It's to actually touch the other rib cage to the ground, which probably isn't going to happen, but it doesn't need to happen. You just need to use the breathing to get you moving more in that direction. If we want to intensify this, going towards either a straight leg position, and I can still stabilize this knee with some type of ball or foam roller so that this has a contact point with the ground, and then I can start moving a little bit more in that direction. And then lastly, I can grab this ankle and go into what's called a bretzel movement, named after the great Brett Jones. And then you do the same type of breathing here. So this is a little bit more intense, but you get it locked in a little bit better so you can feel the breath moving you more. And as long as this isn't feeling threatening to the body and we can use the breathing to move, it can be quite useful with that mid-back pain. And then it's really tied into the breath. So make sure that you feel like you're in control of the movement. Make sure that you're not forcing anything, because that's just not the intention of what you're trying to do with this type of pain. It starts with trying to bring stress down, but then creating more motion in that mid-back or towards rotation becomes quite valuable. Hopefully that makes sense. There was a lot covered there. If you have any questions, please go to movementprofessional.com. I'd be happy to get back to you. I'll see you next time.